Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
Which is the correct order from first to last for proper placement of a urinary catheter? 1. Lubricate the catheter adequately with a water-soluble lubricant. 2. Ensure free flow of urine. 3. Insert the catheter far enough into the bladder to prevent trauma to the urethral tissue. 4. Prepare a sterile field. The correct order is 4. Prepare a sterile field. 1. Lubricate the catheter adequately with a water-soluble lubricant. 3. Insert the catheter far enough into the bladder to prevent trauma to the urethral tissue. And 2. Ensure free flow of urine. After gathering appropriate supplies, the nurse should prepare a sterile field. After lubricating the catheter adequately with a water-soluble lubricant to minimize trauma to the urethra, the nurse should insert the catheter far enough into the bladder so the retention balloon does not traumatize urethral tissues. Ensuring a free flow of urine prevents infection. Improper drainage occurs when tubing is kinked or twisted. The client will have an abdominal hysterectomy tomorrow. Which of the following information will be most important for the nurse to give to the client prior to admission to the hospital? 1. What to wear to the hospital. 2. What she can eat and drink before admission. 3. The type of pain medication that will be prescribed post-operatively. 4. The amount of activity she can have after surgery. The correct answer is 2. What she can eat and drink before admission. It is a priority that the client knows she will not be able to eat or drink for 8 hours before admission. A client who consumes food and fluid before receiving a general anesthetic is at risk for aspiration, which can lead to aspiration pneumonia, respiratory arrest, and even death. The clothing she should wear to the hospital and the type of medication she will receive are important, but not the priority. Information on exercise and resumption of normal activities can be included in the discharge teaching. The client with the flu is prescribed the OTC cough suppressant dextromethorphan. Which information should the nurse teach regarding this medication? 1. Take the medication every 4 to 8 hours as needed for cough. 2. The medication can cause addiction if taken too long. 3. Do not drive or operate machinery while taking the drug. 4. Do not take a beta blocker while taking this medication. The correct answer is 1. Take the medication every 4 to 8 hours as needed for cough. Dextromethorphan is relatively safe in the recommended dose range of 10 to 30 milligrams every 4 to 8 hours. At these levels, it does not produce respiratory depression and side effects are not common. Dextromethorphan is an antitussive. This medication does not have the potential to cause addiction. This medication does not produce drowsiness, so driving or operating machinery while taking dextromethorphan is acceptable. The medication does not slow the heart rate, and there is no reason for a client not to take a prescribed beta blocker medication while taking dextromethorphan.
A client who had received 25 milliliters of packed red blood cells has low back pain and pruritus after stopping the infusion. The nurse should take what action next? 1. Administer prescribed antihistamine and aspirin. 2. Collect blood and urine samples and send to the lab. 3. Administer prescribed diuretics. 4. Administer prescribed vasopressors. The correct answer is 2. ABO and Rh incompatible blood causes an antigen-antibody reaction that produces hemolysis or agglutination of red blood cells. At the first indication of any sign/symptom of reaction, the blood transfusion is stopped. Blood and urine samples are obtained from a client and sent to the lab along with the remaining untransfused blood. Hemoglobin in the urine and blood samples taken at the time of the reaction provide evidence of a hemolytic blood transfusion reaction. Antihistamine, aspirin, diuretics, and vasopressors may be administered with different types of transfusion reactions.
The nurse has been assigned to provide care for 4 clients. In what order should the nurse assess these clients? 1. A client awaiting surgery for a hiatal hernia repair at 11 a.m. 2. A client with suspected gastric cancer who is on nothing by mouth status for tests. 3. A client with peptic ulcer disease experiencing a sudden onset of acute stomach pain. 4. A client who is requesting pain medication 2 days after surgery to repair a fractured jaw. The correct order is 3. A client with peptic ulcer disease experiencing a sudden onset of acute stomach pain. 4. A client who is requesting pain medication 2 days after surgery to repair a fractured jaw. 2. A client with suspected gastric cancer who is on nothing by mouth status for tests. And 1. A client awaiting surgery for a hiatal hernia repair at 11 a.m. The client with peptic ulcer disease who is experiencing a sudden onset of acute stomach pain should be assessed first by the nurse. The sudden onset of stomach pain could be indicative of a perforated ulcer, which would require immediate medical attention. It is also important for the nurse to thoroughly assess the nature of the client's pain. The client with the fractured jaw is experiencing pain and should be assessed next. The nurse should then assess the client who is NPO for tests to ensure NPO status and comfort. Last, the nurse can assess the client before surgery. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Alteplase recombinant, or tissue plasminogen activator, TPA, a thrombolytic enzyme, is administered during the first 6 hours after onset of myocardial infarction to 1. Control chest pain. 2. Reduce coronary artery vasospasm. 3. Control the arrhythmias associated with MI. 4. Revascularize the blocked coronary artery. The correct answer is 4. Revascularize the blocked coronary artery. Rationale. The thrombolytic agent TPA, administered intravenously, lyses the clot blocking the coronary artery. The drug is most effective when administered within the first 6 hours after onset of MI. The drug does not reduce coronary artery vasospasm. Nitrates are used to promote vasodilation. Arrhythmias are managed by antiarrhythmic drugs. Surgical approaches are used to open the coronary artery and reestablish a blood supply to the area.
The nurse is preparing to administer medication in a labor and delivery unit. Which medication should the nurse question administering? 1. Magnesium sulfate to a client diagnosed with preeclampsia. 2. Dinoprostone to a client diagnosed with asthma. 3. Betamethasone to a client who is 27 weeks pregnant. 4. Oxytocin to a client diagnosed with an incomplete abortion. The correct answer is 2. Dinoprostone to a client diagnosed with asthma. The synthetic prostaglandin dinoprostone is used cautiously in clients who have asthma because it can initiate an asthmatic attack. Therefore, the nurse should question administering this medication. The client with preeclampsia would be receiving the anticonvulsant magnesium sulfate to help prevent seizures. Therefore, the nurse would not question administering this medication. The corticosteroid betamethasone is a medication used to increase surfactant in fetal lungs and would be administered to a client who is less than 34 weeks pregnant. Therefore, the nurse would not question administering this medication. Oxytocin, a uterine stimulant, would be administered after a client has experienced an incomplete abortion to help the client expel the fetal fragments. Therefore, the nurse would not question administering this medication.
The nurse is supervising a newly graduated nurse caring for a patient with a fracture of the right ankle who is at risk for complications of immobility. For which action should the supervising nurse intervene? 1. Encouraging the patient to go from a lying to a standing position. 2. Administering pain medication before the patient begins exercises. 3. Explaining to the patient and family the purpose of the exercise program. 4. Reminding the patient about the correct use of crutches. The correct answer is 1. Encouraging the patient to go from a lying to a standing position. Rationale. Moving directly from a lying to a standing position does not allow the patient to establish balance. The supervising nurse should instruct the newly graduated nurse about moving the patient from a lying position first, then to a sitting position, and finally to a standing position, which will allow the patient to establish balance before standing. Administering pain medication before the patient begins exercising decreases pain with exercise. Explanations about the purpose of the exercise program and proper use of crutches are appropriate interventions for this patient.
Which of the following is a potential risk factor for the development of colon cancer? 1. Chronic constipation. 2. Long-term use of laxatives. 3. History of smoking. 4. History of inflammatory bowel disease. The correct answer is 4. History of inflammatory bowel disease. A history of inflammatory bowel disease is a risk factor for colon cancer. Other risk factors include age, history of familial polyposis, colorectal polyps, and high-fat or low-fiber diet. A patient with sickle cell disease is admitted with splenic sequestration. The blood pressure is 86/40 and heart rate is 124 beats per minute. Which of these actions will the nurse take first? 1. Complete a head-to-toe assessment. 2. Draw blood for type and cross-match. 3. Infuse normal saline at 250 ml per hour. 4. Ask the patient about vaccination history. The correct answer is 3. Infuse normal saline at 250 ml per hour. Because the patient is severely hypotensive, correction of hypovolemia caused by the splenic sequestration is the most urgent action. Nevertheless, the other actions are appropriate because a complete assessment will be needed to plan care, a transfusion is likely to be needed, and vaccination history is pertinent for patients with sickle cell disease. Infusion of saline, however, is the priority need. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is caring for a client diagnosed with a stage 3 pressure ulcer. The client has a Combiderm non-adhesive, sterile, hydrocolloidal dressing. Which data indicates the dressing is ready to be removed? 1. The exudate begins to pool on the wound surface. 2. The color of the drainage changes from brown to a yellow-gray. 3. The HCP must write an order to remove the dressing. 4. The softened area is approaching the edge of the dressing. The correct answer is 4. The softened area is approaching the edge of the dressing. This dressing is an absorbent hydrocolloidal dressing that provides a moist environment, absorbs exudates, and is non-damaging to the skin. When the softened area approaches the edge of the dressing, it must be removed, and a new one must be applied. Option 1 would indicate when an alginate dressing, not a hydrocolloidal dressing, is ready to be removed. The iodosorb gel, not the Combiderm dressing, should be changed when the color changes from brown to a yellow-gray. The nurse does not need a written order from the HCP to change the dressing. A child is complaining of throat pain. Which statement by the mother indicates that she needs more education regarding the care and treatment of her child's pharyngitis? 1. I will have my child gargle with salt water 3 times a day. 2. I will offer my child ice chips several times a day. 3. I will give my child Tylenol every 4 to 6 hours as needed. 4. I will ask the nurse practitioner for some amoxicillin. The correct answer is 4. I will ask the nurse practitioner for some amoxicillin. Pharyngitis is a self-limiting viral illness that does not require antibiotic therapy. Pharyngitis should be treated with rest and comfort measures, including Tylenol, throat sprays, cold liquids, and popsicles.
When instructing a client who has been newly diagnosed with vasospastic disorder, Raynaud's phenomenon, about management of care, the nurse should discuss which of the following topics. 1. Scheduling a sympathectomy procedure for the next visit. 2. Using a beta blocker medication. 3. Follow-up monitoring for development of connective tissue disease. 4. Benefit of an angioplasty to the affected extremities. The correct answer is 3. Clients with Raynaud's phenomenon should receive routine follow-up to monitor symptoms and to assess the development of connective tissue or autoimmune diseases associated with Raynaud's. Beta blockers are not considered first-line drug therapy. A sympathectomy is considered only in advanced cases. There is no benefit to an angioplasty, which is used for atherosclerotic vascular disease.
The nurse is witnessing the client's signature on the informed surgical consent for an abdominal hysterectomy. It is important to ascertain that the client understands that with this surgical procedure, she will have 1. Decreased libido. 2. Infertility. 3. Depression. 4. Weight gain. The correct answer is 2. Infertility. The client needs to understand that with removal of the uterus, she will no longer be able to bear children or have menstrual periods. The surgical procedure should not change her libido or sexual functioning. Research does not support the idea that hysterectomy contributes to depression or weight gain. Research demonstrates that women who have managed health problems for some time before the hysterectomy may actually have a more positive effect, with less worry about their health condition, contraception, or pregnancy. A female with uterine fibroids has dysmenorrhea and menorrhagia. After reviewing the laboratory reports, the nurse should report which results to the healthcare provider. Select all that apply. 1. Hemoglobin 9.0 grams per deciliter. 2. Hematocrit 27.1%. 3. White blood cell count 10,000 cells per cubic milliliter. 4. Potassium 4.0 milliequivalents per liter. 5. Normocytic red blood cells. The correct answers are 1. Hemoglobin 9.0 grams per deciliter and 2. Hematocrit 27.1%. A woman with uterine fibroids and dysmenorrhea is at risk for iron deficiency anemia. The hemoglobin and hematocrit indicate the likelihood that the fibroids causing heavy menstrual blood loss have resulted in anemia. A hemoglobin of less than 12 grams per deciliter in women is considered low. The white blood cell count and potassium levels are within normal parameters, and normocytic red blood cells are normal. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.